will be speaking on a topic which has not been covered extensively in our country, and it's unfortunately basically. And if we look from patients' point of view, it's a very important part of their management strategy. I'll be discussing quality of life in Indian glaucoma patients. Uh, Primary open-angle glaucoma is currently affecting around 79 million glaucoma patients worldwide, which makes it a significant public health problem. And traditionally, the management of these patients revolve around disc evaluation, visual field evaluation, and controlling the intraocular pressure. But if we look from patient's perspective, these clinical endpoints are not as important as reading, walking down the stairs, or recognizing people faces, which is much more important for patient. And according to one study, patient value vision more than what we clinician realize. So there is a gap between our perception and patients' expectations. And it's in our best interest to bridge this gap or decrease this gap as much as possible. And fortunately, there is a conscious shift in our management, and we have started incorporating patient-centric outcomes in management strategy of these patients. Coming to concept of quality of life, it's subjective perception of physical well-being, mental health, general health perception, as well as social health of the patient. Or in other words, its ability to pursue a happy and content life in the context of patient's culture and value system. The quality of life in glaucoma patient is determined by several factors: psychological aspect, then vision related issues, then possible side effects of both medical as well as surgical treatment, and of course financial burden. Uh, the quality of life assessment, patient reported outcomes. Uh, Recently, the FDA has coined an umbrella term, that is patient reported outcome, for all these quality of life questionnaires, and we can divide these PROs into three major categories. Category one is instrument addressing functional status related to vision loss and disease specific, that is glaucoma quality of life 15 as well as Vishwanathan 10 questionnaire. Then instruments addressing overall quality of life, which is NEI VFQ25, or instrument assessing other factors related to disease like symptoms or treatment side effects. The vision specific PROs have advantages that they are able to discriminate even mild disease from normal subjects. And however, and they have advantage of being short and simpler to administer. Whereas instruments assessing overall quality of life like NEI, they have advantage of assessing the psychological aspect, which is very important part of glaucoma patients, but they are difficult to administer and take more time. And ideal PRO instrument should be easy to use, reproducible, should have simple questions and easily understandable scoring system. And unfortunately, we don't have any ideal PRO instrument till date, and there is still lack of clarity as to which instrument is best for elucidating quality of life among glaucoma patients. And unfortunately, there is very little data, very few studies which have compared these instruments. One study from Nigeria compared GQL 15 and NEI VFQ 25 in assessing quality of life in glaucoma patients, and they found that both the instruments could reliably assess quality of life. And they also found that there is strong correlation of scores in both the instruments with increasing severity of the disease. And they found that GQL 15 was easier and faster to administer. And then a departmental study which has been published in Indian Journal of Ophthalmology in January 2019 issue. So we included 140 glaucoma patients, which included mild, moderate, and severe disease, and using multiple questionnaire, NEI VF25, GQL 15, and Vishwanathan 10 score, we found that all three instruments were reliable in assessment of mild, moderate, and severe disease, and they strongly correlated with each other, all the three questionnaire, in relation to their subscales, domains, or questions. And NEIVF additionally gave information regarding general psychological and social effects of the disease. And we found that till the time we have an ideal PRO, we should be using multiple PRO to have more comprehensive assessment of quality of life in these patients. Then coming to quality of life in Indian glaucoma patient, there is positive literature regarding quality of life study in our country. In one study published in Journal of Current Glaucoma Practice, it's of 50 patients using GQL 15. They concluded that quality of life worsened with increase in severity of the disease. Another study published from our department in Indian Journal of Ophthalmology in 2018 March issue, study of 180 patient. We had mild, moderate, severe glaucoma patient as well as a control group. So in our study, all the three instruments, we use three instruments, that is NEI, VF, Q25, GQL 15, and Vishwanathan 10 instrument. So our study found that all the three instruments showed decrease in quality of life in glaucoma patients compared to controls. And with increase in severity of glaucoma, there was corresponding decrease in quality of life with all the instruments. So it's very important, it's very important from ophthalmologist point of view to incorporate these quality of life assessment in glaucoma patients so as to have more holistic approach for these patients. Activity limitation is another aspect at disease versus the patient has activity limitation. So Salisbury eye evaluation study found that patients having bilateral glaucoma, they are 5 times more likely to have severe difficulty with near activities and night driving task as compared to glaucoma patient. An Indian study of around 200 patients from LV Prasad Eye Institute using GL9 questionnaire. They concluded that with severe visual field loss, patients face significant challenges in performing daily tasks as well as in mobility. So a departmental study, which is currently under consideration for publication, we used multiple instruments, NEI, VF, GQL 15 and GAL9. So we found that GAL9 was best in assessing quality of life in these patients as well as in studying the activity limitation, and it was found to be less time consuming. So in all POAG patients, the most significantly affected domain was related to dark adaptation and glare. So in moderate POAG patient, the most significantly affected domain was related to peripheral vision, whereas in severe glaucoma patient, the most significantly affected domain was related to central vision. Then coming to ocular surface disease, all of us while treating glaucoma patient with single or multiple medication, we find that all these patients have ocular surface abnormalities. So ocular surface disease affects around 59% of these glaucoma patients, and 36% of these patients will require some sort of treatment. So in a large study of on around 180 glaucoma patients, the authors found that the use of topical drugs will lead to decrease in quality of life. And another study found that higher frequency and higher bag concentration in glaucoma medication is further associated with ocular surface disease and poor quality of life. Another departmental study which has been published in Turkish Journal of Ophthalmology April 2020 issue, we included 110 patients and divided them into 3 groups. 40 patients received bag-preserved travoprost, 40 patients received bag-free travoprost, and 30 patients were age-matched controls. And we found that bag-preserved travoprost leads to highest OSDI score. So we basically did OSDI score as well as glaucoma quality of life 15 questionnaire. So the higher OSDI, they correlated strongly with poor quality of life as compared to bag-free travoprost. So shifting these patients from bag-preserved formulation to bag-free formulation will help in improving the quality of life in these patients. Then coming to effect of surgery on quality of life, only one type of surgery was found to improve quality of life was laser procedures. And worst procedure for quality of life in these patients was glaucoma drainage device. Another study comparing medical versus surgical treated glaucoma patient using NEAVF Q25 instrument showed that surgery was a predictor of poor quality of life, especially in early glaucoma patient and mainly due to psychological burden. And there is hardly any study comparing the quality of life in severe glaucoma patient after glaucoma filtering surgery or GDT. So we have designed a study in our department comparing the quality of life in severe glaucoma patient, which are either on multiple drugs or who have undergone surgery. So I think this will give us clear picture whether in severe glaucoma patient the quality of life improves or worsen after glaucoma filtering surgery. Then major issue with PROs is that they are subjective. So performance-based measures or PBM, they directly evaluate patient's ability to perform tasks. So we give a task to the patient and directly observe. So we can clearly see whether a patient is having some problem in performing that activity. So PBM are objective measures, but unfortunately they need elaborate setup. So in a country like India, where there is always resource issues and huge patient burden, I feel PRO are still practical way to assess the glaucoma quality of life in these patients. So take home message from my talk is quality of life is affected in a big way in glaucoma patients. So glaucoma specific PROs, they directly target function affected by glaucoma, and they are easy to administer. But uh, the overall quality of life assessment PRO, like any VFQ, are still relevant because they assess mental health status also, which is affected in a big way in glaucoma patient. And till we have an ideal PRO, the use of multiple instruments offer more comprehensive assessment. And GAL9 is easier, faster, and better way for activity limitation in glaucoma patients. And shifting to preservative-free topical medication or safe preservative topical medication may improve quality of life in our patients. And surgery significantly worsen quality of life in especially early glaucoma patients due to psychological burden. And incorporating quality of life in routine management can help clinician to customize most appropriate treatment for their patient. So thank you for your kind attention.